As we mentioned, many popular athletic activities can cause pelvic floor dysfunction. For instance, landing positions in common sports like gymnastics and track. Dance, running, gymnastics, track, soccer, martial arts, and others place heavy emphasis on core strength, tight body positions, and breathing from the chest instead of the abdomen. Tight and clenched stomach, buttocks, legs, and chest breathing are necessary to perform many of these athletic activities well. However, if these body positions are carried over into everyday tasks and daily living, they can be harmful to the pelvic floor. As you've learned, a tight, tense, and turned on pelvic floor will eventually lose its proper function. Along with overly clenching techniques associated with training for many of these sports, there have been more injuries to young women over the past number of years, with increasingly competitive young female athletes. Injuries to ankles, knees, hips, tailbones, and straddle-type vulvar traumas all have contributed to chronic pelvic and sexual pain as well. The book entitled Warrior Girls: Protecting Our Daughters Against the Injury Epidemic in Women's Sports by Michael Sokolov points out the consequences of cumulative injuries in young women, not necessarily solely from the lack of appropriate training over the course of their pre- and post-puberty years, but also by the exuberance and passion and competitiveness that so many girls exhibit throughout the course of their athletic years. He points out that so much has been learned in the field of sports medicine and training that could be preventative for injury, but that commonly many factors prevent the implementation of good practices by the coaches, trainers, and even the parents of these young women. These cautions are certainly not meant to endorse quitting sports altogether. Instead, we are asking you to be aware that you need to let clenched body positions go when you walk out of practice or performance. If you are a family member or friend of a young female athlete who may have the early symptoms of pelvic pain, try to talk to them about the consequences of holding clenched body positions, even though this is quite countercultural right now, because it seems everyone is out there trying to actually strengthen their core. If you are injured or feel pain, don't allow yourself or a family member or friend to push through the pain to keep performing. If you would like to learn more about our prevention and education initiatives, or would like to donate to the program, please visit the Foundation for the Prevention of Chronic Pelvic Pain at thefpcpp.org.